Hello, my name is Karen, and I am an occupational therapy student at Kaiser University's MSOT Bridge program. As part of my virtual fieldwork experience, I am creating weekly videos on various topics. This week's topic is discussing what I learned this week, as well as the different practice settings that there are for occupational therapists when working with adult clients. The first question this week is, what did I learn? This week, we had the opportunity to watch a video that outlined a young man's journey from childhood to his time as an adult in his mid 20s. He was diagnosed with ADD as well as Asperger's syndrome, and he was outlining the struggles he faced while he was in school with bullying, also feeling as he didn't have a place to fit in, and then as an adult now, how he's functioning now that he has a wife and kids, and what his new purpose is in life. After watching the video, we were tasked with completing an intervention plan, coming up with what his biggest deficits were with his performance in various occupations, creating goals for him, and analyzing what performance skills he was really good at, what performance skills he was lacking. I felt that this was really good practice for us as becoming occupational therapy practitioners, because as CODAs, we get the plan and the evaluation for us, and it kind of outlines what we need to work on, where the client's at. But it's a new experience to look at an individual and be able to say, okay, he's struggling in this particular area, and this is what I'm going to do to work on it. Or this is my goal because it's going to address these different client factors or this different performance skills and performance patterns, that kind of thing. So this activity really allowed us to practice with our OTHs and analyze a client and come up with a plan of care. The next question this week is, why is it important to understand the different adult practice settings where occupational therapy can be found? This is really crucial, even if you're not super in depth familiar with what an occupational therapist might do in a different setting than your own. It's still important to know where occupational therapists can practice and a general outline of what their role is in that facility. This is because whenever your client is discharging from your care into somewhere else, you need to be able to advocate for them and say, oh, occupational therapy can follow you there. For example, when your client discharges from the acute care hospital, you can make the recommendation on if you think it would be best for the client to go to a skilled nursing facility versus inpatient. If they're going home, you can make the recommendation for home health services. By knowing where occupational therapists practice, you can therefore have a better idea of what your client can expect when they get to this new destination, and also help tailor your advice on what services they may need when they get there. If you had to choose, which adult practice setting would you prefer and why? I currently work in an inpatient rehab facility, and that is definitely my preferred preference. I do not have experience being employed at any other facility. I did do fieldwork rotations in a hand clinic in a school setting. I've followed at a skilled nursing facility. But overall, just with my general knowledge of the different practice settings available to me and also my experience, I definitely prefer the inpatient rehab facility. It's the perfect opportunity for a therapist to help make a difference in their client's performance. The clients typically stay with us for about 2 weeks, which is a nice time to be able to make a difference, but they're not staying there long term as they would like with a skilled nursing facility where they might be there for a few months. And also, I really, really enjoy the fact that my patients who are with me are there for therapy. At an inpatient rehab facility, that's your primary goal, that's your primary focus. So it's really nice for my services to not only be what's wanted, but also kind of placed on a little bit of a higher pedestal, I guess you can say, because that's definitely why they're here, is to get stronger so that they can go home. So whereas if you're in an acute care setting where they came there for a medical issue, and yes, they might be getting rehab also, but their primary concern is that medical problem, or if they're in a skilled nursing facility where it's going to be a little bit less intense and their goal is just to kind of either maintain or make slow progress at a more distributed rate, versus like home health where therapy is just on the side, the client might not be as engaged in it. Inpatient is really nice because that's why they're there, and they also get that benefit of having daily intense therapy sessions. I get to see my patients for 90 minutes a day, 5 days a week, and then also on the weekends sometimes. So it's really nice to be able to watch the client progress while they're with me, and also be able to make a big difference in that 2-week period time. If I had to choose which adult practice setting would be the most challenging and why, I would choose the most challenging setting to be the acute care hospital, just because those therapists are having to work with patients who are probably still a little more medically fragile, a little bit more unstable. They're fresh out of surgery, or they might still be in the ICU. The thought of managing a bunch of different IVs and machines and having to track that very delicate medical status is a little bit intimidating. And also, from what I've heard from my friends who do work in the acute care setting, you really only get the patient for a couple days. So that would be very tricky to try to, initiate that bond with the patient and also start making progress when you only have a very limited time span. I've also heard that sometimes they only get to see their patients for one session. So your one session is an eval, a treat, and a discharge all in one. So that mix of being super fast paced with also patients who are a little bit more fragile definitely sounds like a challenge. Something that I would look forward to maybe experiencing during field work, to get to try it out, but I definitely don't know if I'm up for that challenge for full time employment. But it would definitely be interesting to experience. And finally, what are 3 evaluations or assessments that can be used by an occupational therapist within the acute, inpatient, rehab, and outpatient adult settings? 3 assessments that can be used across the board are the FIM, the Functional Independent Measure, the Barthel, and the TUG, which is the Timed Up and Go. The first 2 assessments are looking at a patient or client's performance with basic activities of daily living, as well as some instrumental activities of daily living with the Barthel. So it's assessing how much assistance a client needs when performing dressing, bathing, toileting, grooming, those kinds of aspects. And the Timed Up and Go, or the TUG, is looking at a patient's balance and their ability to walk as far as their gait speed. So the client gets up from the chair, walks about 10 meters, and comes back to sit down, and you measure that time. This is used as an indicator for their balance and their predictor for a fall. All 3 of these assessments are going to analyze aspects that are important regardless of where the client is in their medical journey. If they're still in the hospital, they're going to want to look at how much assistance they need when they're performing their basic activities of daily living, or their BADLs, as well as their balance. Are they going to fall when they get home? Do they need assistance to get dressed? That's going to help determine where they go for their next placement. Let's say they go from acute to the inpatient facility. Inpatient now needs to get a baseline of the level they're performing at with how much assistance with those ADLs and their balance, and they can use those assessments as a way to track progress throughout the client's stay. And then when they leave and either go home health or outpatient, those assessments can once again be used to determine if the client is able to function at home alone or if they're still needing a little bit of assistance. That TUG can tell you in the outpatient setting of how's their balance looking, do they still need to be using these assistive devices when walking, that kind of thing. So because those aspects are things that the client needs no matter what practice setting they're in at the moment, that's why those 3 assessments can be used across the board despite wherever the occupational therapist is practicing. Thank you so much for joining me this week.